Welcome, and I'm going to talk about tight glycemic control in critically ill children. Definition: glycemic control refers to the continuous measurement of blood glucose and can be performed at any time using a handheld device called a meter. The pancreas does not produce insulin, which is an hormone that helps the glucose to enter the cells to give them energy. Without insulin, too much sugar is left in the blood. The traditional meter comes with test strips, small needles called lancets, and a journal to record the numbers. There are many different kinds of these meters, but essentially all work the same way. Causes and consequences. Causes: 1. If you are obese. 2. Have a family history of diabetes. 3. Do not exercise or eat well. Consequence: an excess of blood sugar can also cause long-term injury to the body tissues. For example, it can injure blood vessels that lead to vital organs, which increase the risk of heart disease, stroke, kidney disease, vision problems, and neurological problems. Also, children with diabetes who do not control their blood sugar concentration may also have growth and development problems. They may even be delayed at the onset of puberty. Normal blood glucose control values before meals from 90 to 130 milligrams per deciliter, after meal less than 180 milligrams per deciliter. Values may vary depending on physical activity, meals, and insulin management. The range of normal values may vary slightly between different labs. Talk to your doctor about the meaning of your specific test results. Low levels indicate the presence of hypoglycemia. You need to eat something and you may need to change the next dose of insulin and probably also future dose. If the levels are too high, this indicates the presence of hyperglycemia, in which case one may need additional insulin. Treatment: the American Academy of Pediatrics established that the treatment of infants will depend on certain factors such as the stage of growth and development in which the child is, the amount of food he eats, the activities he performs, etc. With this information, the specialist will dictate the type, dosage, and frequency of insulin to be used. It should be noted that all the methods of insulin supply have its advantage and disadvantage. For example, the patches eliminate the need and the hassle of putting injections. According to the American Diabetes Association, the most advisable for the children is the plasma and injections. However, the advantage of their application should be discussed with the pediatricians at the care center specializing in the treatment of the disease. Issue apply in Ecuador. Ecuador registered 80.6% of children under 5 with overweight, while in ages between 5 and 11 years the index is triple, reaching 29.9%, and in the case of adolescents up to 26%. Susana Barra Paredes was an endocrinologist and founder of the Club of Diabetes of the Hospital of Children Roberto Gilder, indicates that many parents do not accept that their children are diabetics and that they have to apply their insulin all their life. Parents don't assimilate the situation. They must understand that without insulin, the children are discompensated, often even brought in diabetic coma. Gabriel Garcia, boss of statistics of Children's Hospital, has registered 772 attentions to 700 patients between 2015 and 2017. Dr. Solis says there is no predisposing factor for causing type 1 diabetes. Neither parents nor patients are responsible. It's autoimmune, which is why the diagnostic should be effective. Conclusion: it is important that you become aware that the type 1 diabetes is difficult to use condition and requires 24 hours care. Support should be comprehensive and involve endocrine doctors, pediatricians, nutritionists, nurse, psychologists, and diabetes educators. In addition, the treatment is very expensive, exceeds a life minimum weight for per month because for a good control is need a monitor glucose test strips and measurements that are between 4 and 8 a day, insulins and sirens analogs for a month average of 120 injections. So thanks for watching.